Drug overdose deaths dropped significantly in 2024, according to data put out by the Centers for Disease Control this week. A 27% decrease over 2023 to the lowest level in 5 years. Fentanyl continues to be the cause of most of those deaths, but even those fentanyl-related deaths fell even more than that, down 37%. However, the trend is going the other way in a small Oregon coastal town where drug overdoses are actually on the rise. We often hear about the fentanyl crisis being a bigger problem in bigger cities across the region, but drug overdoses know no bounds. And as Blair Best from our sister station in Portland found out, they're happening weekly at a seaside homeless camp in Clapstop County.
Stepping through this seaside encampment,
Cigarette. You need a cigarette?
Lindsay Veenhuis
How you doing?
Good, how are you? Right. How's it going?
sees more than most people.
To help kind of connect with people and show them that we care.
She recognizes what those here are going through because she's been in their shoes.
I have slept in those storage units right over there. Yeah.
Lindsay is a recovery ally with Clapstop Behavioral Health Care.
And now I work with the team that helped me get sober.
She connects people on the streets with addiction and housing services.
I was actually a heroin addict, so it was kind of before the fentanyl was around, and I'm very fortunate for that, actually.
Since the start of this year, 19 people have died from an overdose in Clapstop County, 16 of those from fentanyl.
Yeah, so.
Lindsay knew 5 of them.
It's terrifying. It's really scary.
Many others are overdosing and surviving. One woman told us it happens out here a lot.
I just run to wherever somebody's screaming help.
She didn't want to show her face, but tells us she stays at this seaside camp. She tries to help when she thinks someone is overdosing.
The first thing I do is see if they're breathing, which usually they're not.
How often does this happen?
At least weekly. I mean, there's probably somebody dead, probably at least twice a week.
Michael knows what that's like.
Well, being someone that's died like that before and come back, well, I'd say, it's pretty sad, actually.
How many times have you overdosed?
I don't know, 5 or 6.
When you're on fentanyl and you're hooked on that stuff, like, you really don't care or think about much. You just want to not be sick.
It makes you feel really powerless on how to get a handle on things. So.
Trista Boudon.
Yeah, this is our rapid access clinic. It is open Monday through Friday from 8 to 5.
Works in recovery services at Clapstop Behavioral Health Care.
We're going to all of the camps. We're going all across the county. We're seeing it in the homes, but a lot of people just see it outside the homes. This is not just an unhoused population person issue. The substance use does not discriminate.
What we're looking at right now are different gauge syringes.
At the county level, Nadine Campbell Davis is part of the harm reduction team.
So this is our harm reduction vehicle. This is mobile.
Each week, they park it in Astoria and Seaside. It's filled with drug supplies and other resources.
So we have tourniquets, we have saline, we have alcohol wipes, we have cottons.
Last year, they gave out 1,100 kits of Narcan. So far this year, 500.
I don't think it's enabling the crisis. I think what it is doing, it is helping our community by destigmatizing.
On average, Nadine says, one person each week will agree to treatment.
It's a tough one. It's hard. I'm with the clients every week. I see them. I hear their stories. I see their faces. I see their pain.
We're really working to give people as many off-ramps as possible before they get to overdose.
And compared to urban areas, those on the coast say it's a tougher fight here.
Resources are more scarce. They're very far apart. We don't have as much infrastructure for transportation.
It's kind of just whatever we tend to bring that day, and people are like really grateful for it. So
the drugs know no boundaries.
Clatsop County Sheriff Matt Phillips wishes they could do more to stop the flow of fentanyl into the community.
One of the challenges has been staffing levels. I have commitment from the other 5 chiefs of police in Clatsop County that they would love to staff up a team to focus on drug dealers and crimes related to substance abuse and use. And right now, most of the agencies aren't fully staffed.
Still, they're doing what they can.
With the purchase of this machine, we can run the toxicology the same day if necessary.
The sheriff's office just got this new testing device. It confirms in real time if fentanyl was the cause of a fatal overdose. They're the first county in the state to have such a tool.
One of the challenges with tracking overdose deaths is the length of time it takes to get toxicology results from the state.
As for those non-fatal ODs, like the ones happening in this seaside camp,
we really know about very few of the overdoses because of the proliferation of Narcan in the community. It makes it a challenge to understand the scope of the problem.
a problem that's only getting worse.
You wonder how people could live like this? Well, it's easy if you have fentanyl. You could be comfortable anywhere, and it's just the way it is.
For so many on the streets, no matter the city, drugs are what is keeping them there. It may not be how they got there, but it does make getting off the streets much more difficult. With fentanyl being what it is, it allows people to cope with, living in a tent in the cold, and not to mention the myriad of other dangers that come with street life. As agencies try to keep pace with this crisis as best they can with limited resources, there have been some successes. When Oregon's law changed this past September, making possession of user amounts of hard drugs a crime again, the governor encouraged all counties to create deflection programs, options for treatment over jail for people caught solely with possession. Believe it or not, Clapstop County's deflection program is one of those places that is having success. Clapstop Behavioral Healthcare Recovery Services Assistant Manager said multiple people have graduated that program who are no longer using drugs.